viewers, welcome to this week's episode on Health Watch and Advent Cable Network Nigeria, ACNN. I am Angela Emeka Ibiwo. In most African communities like Nigeria, it is a taboo to discuss sex or sexually related activities with adolescents. Young people are forbidden from asking any questions or speaking about their sexuality with adults, even if they are their parents. This attitude is perhaps the greatest hindrance to adolescents making informed choices about their sexuality. Additionally, many young people who have the necessary knowledge are unable to utilize it due to the same social norm. So, if an adolescent asks a question about the changes they are noticing in their bodies, it is received with a lot of suspicion and stigmatization. It is worthy to note that over 30 million Nigerians are between the ages of 10 and 19 years, and nearly 1/3 of Nigeria's total population is between the ages of 10 and 24 years. That is about 50 million persons. So the program today affects a large number of persons. Our discussion today is targeted at adolescents, especially the female, who may be watching, or parents who are finding it difficult to discuss this topic with their female teenagers. In following episodes, we will focus on the male teenagers. My guest today is Mrs. Eunice Babatunde. She is a chief matron retired of Asokoro General Hospital here in Abuja, and she specialized in pediatric nurse. Mommy, like I normally like to call you, you're welcome to the program.
Thank you very much.
And it's so good to have you. And let me even say that mommy is mommy indeed. And I believe you will do justice to our discussion today.
God will help us.
Yes, communicating to our young people. So let me even start with my story. You know, when I was young, there's this advert they used to show on TV. And it had to do with one of the brands of sanitary towel. And they would pour liquid on
yes.
it, and then take a napkin or something and put on it. And then one will absorb and the other will not absorb it.
Exactly.
And I remember asking my aunt, what is this? And she told me, when you grow up, you will know. And every time I watch this advert, and I'll be wondering, what is this about? But before we even talk about that, you know, we want to target our ladies, the adolescent, the young girls. And I want to start with knowing what the adolescent stage is in a lady, because we're focusing on the women today. And what are those things that the lady notices that shows that she's an adolescent or between the adolescent age, before we start talking about all the experiences we've had as young people?
Thank you very much, Angela. This is a very good program and timely. Very, very relevant, especially to our youths nowadays. The age of teen, adolescent is between the age of 10 to 19. When we want to talk of 19, we can take it back to 8 years. You know, just as rightly said before, years back, girls don't start menstruation until around 12 years, 14, 15.
Yes.
But nowadays, you see girls of 8 years, 9 years menstruating. So it is good to also consider them in this type of discussion. And it is the age group that the individual, as they grow in stages, experience changes. It could be physical, it could be mental, it could be social. When it comes to the physical body, now that we are concentrating on females, they notice growth in their breast.
Okay.
They just notice that this breast is getting bigger. And that time they may be feeling shy. To speak out will be difficult. To mothers out there, it is good to prepare girls, especially when they notice that their breast is growing. They should encourage them. Oh, my dear, you are now growing. This is normal. Don't think any problem is there. Then you see their hip get wider. And you see some psychedelic girls walking and as if they are making younger. It's not their fault. It is just the changes.
Yeah.
Then another important thing at that age is menstruation. Menstruation is another stage in a normal female. It can come at any point of age. It is a period the girl sees blood. It is called tears of uterus. Because from teen age to menopause, it comes every month, except during pregnancy. There is no menstruation during pregnancy. But without pregnancy, a mature lady experiences menstrual flow every month. It ranges from days of month and number of days it flows. So those are the things mothers should prepare their daughters. They shouldn't wait until they go outside to go and learn it. Unfortunately, some of them don't even learn it outside. They just see that they get out from class and somebody say, what did you sit on? There is blood in your cloth. And it can be so embarrassing. So you see them packing the cloth and rushing to the hostel. For the maybe schools that are that has boarding and they have good matron, it is also their duty to put the children in order. But for a mother that knows that this girl is going out and is between this age of menstruation, sit her down, teach her, and buy sanitary pads. If it is not there, she can use anything. Some of them see tissue paper they use. Some of them will tear their cloth and fold it. And those things can cause infection, which it is very difficult to manage, especially in future. Because somebody that is not bold to ask for sanitary pads will not be bold to speak out of any sign of infection, either itching or discharge or whatever. And it can ascend to cause complications even in the uterus. And during the reproductive age, it causes infertility. So it has to be prevented. With proper hygiene.
Okay, we're going to talk about hygiene. We're going to talk about even how to use sanitary towel. You know, when you're talking now, what you're saying resonates with me. And I'm trying to use myself as a lot of experience, you know, to share lots of experience so that people know that young girls watching or mothers that are struggling can call their daughters, come and listen. I remember my first experience of my breast. I felt like the whole place was a bit hardened and felt slight pain and discomfort. At first, I didn't know what it was. I said, why am I feeling like this? And this was at about 10 years old towards, and I didn't talk to my mom. I didn't say anything because I felt something, you know, it's happening to me. So if there's a little girl watching and you notice there's hardening around the breast area, you know, please draw the attention.
Be bold, yes.
Draw the attention.
Speak to mommy. Tell mommy how you are feeling. And I'm sure every good mother will be able to put their children through how to manage such things.
Then when I first saw my menses as well, what you're saying is so true. I was very shy. I was very afraid. I just woke up one morning. I remember in the month of August, and I noticed it was just, my whole body changed. I couldn't talk to my mom because I thought I did something. And I was trying to think, what did I do? Why am I bleeding? And then I had to speak to a friend of mine. And she said, just take tissue, wrap it, and put it. And she said that's what she's been doing. But I noticed when I put it, I was so uncomfortable. I was lying in one corner. I was so afraid to talk to my mom. But when I finally spoke to my mom, she was the one. She didn't really guide me on things. It was an aunt who now called me and started teaching me because I was using toilet roll for some time. But just as you said, some people just put toilet roll or even use cloth that makes it dangerous. So if you notice such a thing, to speak to somebody if you don't know.
It's very important.
about it. Now, when is there any sign before the blood starts coming that a lady notices, or it's just normal? They just do you know this pain or?
Yes, there are some feelings which also differ depending on individual. Some don't feel anything; they just notice that they are wet.
Yes, I
Some may feel some heaviness on their breast 2-3 days before the flowing day. Some could be mild abdominal pains. Some could be severe abdominal pains. In fact, those who experience abdominal cramps, most of them are off class or activities during their menses, except if some analgesic is given before the flow or during. So it depends on individual what they feel.
Okay, so now hygiene. Let's start with how to even use the sanitary towel. And why I'm doing the sanitary towel is because I was coordinating the Teens Chapel in our church then, and a young lady came to me and she said she doesn't really know how to wear sanitary towel. She doesn't know when to change it and all that. And I was really surprised because she was not that young. She was a bit, maybe 13, 14, and I was really surprised. So today, if you don't know how to use it, please stay and watch and learn. And if mommy is here and you can't tell your daughter or teach your daughter, please bring your children close by now to learn how to use sanitary towel. So mommy.
Thank you. The use of sanitary pad is the best in menstruation. Yes, some people use pieces of cloth. They wash, dry and iron. It depends on maturity and how you can keep it clean. But thank God for sanitary pad. Very simple, very available and affordable. So when you buy, you open it inside pack. Yes, just pick the one you need. Remove the seal. Open it. As much as possible, don't let your hand touch the center of the sanitary pad. During my own time, I didn't use this much.
Okay.
It is, I think, lady sept pad, very long and thick.
That was very
In fact,
uncomfortable.
I'm very, very uncomfortable. I remember I usually cut it into 2.
Oh, wow.
Because it is so big,
yeah.
and even to walk may be difficult. So when you cut it, it's easier.
Okay.
But that is not the best anyway. So this is sanitary pad.
So it's good to also clean your hand to make sure that it's not.
Hand hygiene, very important. Wash your hand with soap and water. Then pick your sanitary pad. This is paper. Remove it. It has gum behind it.
Yeah.
To access that gum, remove the paper. Remove the paper. Get your pants. We don't have pants here, but we are going to make use of what we need. Let's assume that this is the pants. Stick the sanitary pad on it. Angela, watch you because you are more current.
Yes, you're right. You're right. They stick it
So
on.
then you remove this and then wear.
Yes.
So most of the time they stuck the edge on the pants,
edge, yes, you put
just
it around the pants.
to make sure that it's not removing or moving as the individual is walking. That is that. If you are going to use pieces, still make sure your hands is clean, the piece is clean. Fold it to the size you want and the length you want. Just put it to cover the vaginal orifice, because that is where the blood comes out from. So it just goes straight into the piece, and it is important to change it frequently. Even the sanitary pad, for hygiene purpose, you can't wear one from morning till night. One, it will stink because you are sweating, and by the time the two meet a hand, it will cause some offensive odor. So one should change as frequent as possible. The flow is heavy, but it still differs from individual. There are some people that, if not for hygiene, they can wear one part for a whole day and it will not be soaked. But for some people, within an hour or two, they will need to change because the flow is heavy, especially the first two days of flow. So as they get to the end of the flow, it reduces. And the last day, you just put it in case. But it doesn't really flow heavily.
So, and it's important to clean in between.
In between
just,
what?
when you're changing your pad, you don't just remove one and put one on. It's good to clean the vulva area.
You are right.
Yes.
Especially with water.
With water.
Clean water. Although some people use this wipe, but water is the best if the opportunity is there.
Yes.
Some people have complained, what if they are in the office or they are in the class or things like that. At every opportunity, use water to wash. When the individual washes, then you can now put another one. If the pant is stained, the person should also change the pants. It's not a must that you change the sanitary pad and leave the pants. The two should be changed if it is stained.
Okay.
But if it is not stained,
change to another
you can
one.
still use it, but not the following day.
Okay.
At the end of the day, that pant, either stained or not, it must be washed.
Okay. To maintain hygiene.
Yes. And at the end of the menses, all the pants used should be soaked with hot water, with little Dettol. Wash it, dry it under sun. Many people are ashamed to dry it under sun. In that case, you can iron, just to make sure that no germ, no bacteria.
So it's very important, the hygiene of it.
The hygiene is very
important.
Very, very important. Because if there is infection, especially for females, it is difficult. Difficult to manage, especially if it is prolonged. And by the time it is chronic, the story will be unpleasant. So it's better to prevent infection than to cure it.
Okay, but for the modern day, I know that you can't flush this in the toilet.
No.
Suppose you have to wrap it back.
Thank you for that.
Yes.
You wrap it, the gum will stick it.
Back,
yes. So you can get polythene or nylon bag, put it inside and put it in waste bin, not in the toilet. Some people in the villages, they are so much conscious of evil people. And so you have to be careful where you dispose your sanitary pad. I learned some people even go around to pick it in the hospitals and wherever. What they use it for, I don't know. But if one finds herself in that environment, know how to dispose your sanitary pad. Pit toilets are not common. It would have been the best
to dispose it
to dispose the sanitary pad.
And some people say they wash everything out before they wrap it. And I don't know how that was.
What? That's another prevention. So even if anybody picks it, nothing to fear about it. It won't be useful. So it's okay.
Thank you so much. This is a lot of information, and it's looking normal for people that know how to use it, but it is actually not normal because there's so many people that really don't know how to use it.
When you are ignorant of a certain thing, what you are doing seems to be the best to you, but learning is important.
Okay, there's a time you also talks about the method of cleaning. We have people that have this urinary tract infection, and all that is because they clean either from back. I don't know, there's a direction to clean when you clean.
Urinary tract infection should be prevented from babyhood. And this is a challenge to mothers. Mothers who are nursing baby girls from birth. When you are cleaning them, this is Pampers, but I will use it to demonstrate how to clean because the shape is close to the part we are discussing, both the anus, the female organs, and the pubic area. You see, this is anus. When a child poo-poo, most people uses wipe. Personally, I prefer water. Just get water inside the bowl, sit the baby inside, wash. You see, the vulva area is in layers. The mother should be able to open each layer and wash. If she's using wipe, don't start from the anus. This is the back. If you take it up to the front, you are packing the dirt from the anus across the orifices, there are tiny openings here, and then it will block, causing infection. And so it is always correct. You start from up, down.
Okay, up, down.
Pick another one, go to another layer. Because of economy, that same one could be folded, you use the other. Otherwise, if it is available, each for each layer. When you do that, you now take the clean Pampers and use. Otherwise, if the cleaning method is wrong, you will just find out that the baby cries, at times having high body temperature. The baby is so small, cannot tell you I'm having.
Yes.
At times, because the Pampers is there, it could be the period that baby is passing urine, because there is burning sensation. But the mother will not know. She will just notice that this baby is crying. And after the baby is relieved, the baby will keep quiet. So it is always better to maintain proper hygiene technique, cleaning technique.
Yes.
For boys, it is easier, very, very easy to clean them up. But for girls, and then for girls that are the age of maybe training how to use potty,
Yeah.
still apply the same method. Clean them well. Don't think that they are grown up, they should just get up and continue to play. If they continue to play, that feces on the anus will spread and it will cause infection.
Okay.
By the time the child is getting up to 3 years of age or 4 years of age, whoever is taking care of that child should be very careful, and especially the mother. If you have housemaid, there is nothing wrong in it, but you as a mother should take time to bathe your child once in a while. When you are bathing the child, concentrate on the folds of the pubic area to the anus and the rest, and then watch the baby. As you are watching, is there any sign of pain? If you touch the vulva, any part on that side, and the baby is either shock or showing that there is pain, then watch. Probably that child is being abused, molested somehow, fingered, and things like that. Mothers should not trust any house help. Mothers should not completely abandon. Let me use that one, abandon. By the time a mother sees house help, auntie, uncle, somebody stay in the house, and you say, he's the one taking care of this baby. Week to week, month to month is that person. It is very dangerous. Very, very dangerous. So when you do it yourself once in a while, you're able to take note if there is any changes.
1 week, or if you're too busy,
Yes,
3-4 days.
it's supposed to be so, but most mothers are so busy from morning till night. They don't know what is happening to the children, which is not too good.
Not too good.
It is not too good.
At all.
That is why most babies or children are assaulted, abused without the knowledge of the parents. So parents should be more observant. Yes, more observant.
Okay, let's talk, and that is very good, and I believe mothers are watching and listening, because very, very important to be observant. And the care of the child or the girl child starts from when she's young, when she's a baby.
Yeah.
How you clean her up to maintain hygiene. So because you may pay the price of lack of hygiene later in her life, which is not good. Now let's talk about the things about hairs growing under the private area, under the armpits, in this. How frequently should a lady be washing? That is when she's not on her period or cleaning. Sometimes even when you start getting older, when you sweat, there seems to be this smell like that oozes out of different parts of the ladies. But so how do you maintain that hygiene for the teenage ladies?
We mentioned earlier changes that takes place at teenage, adolescent, like that. And puberty includes growing of hairs on the armpit, pubic area, both male and female. Males, their own can even be on the face. But for females, it's more on the armpit and the pubic area. For the body odor, let me put it that way. It is not just because the individual is growing hair, but because the hormones at that age increases and the glands makes individual to sweat more. There are bacteria that lives normally on the skin. So by the time the sweat and the bacteria react together, bad odor occurs.
Okay.
And so when the individual at the end of the day do not have his or her bath, or you keep repeating the same dress, because some people, they actually take their bath, but still, when you stand by them or they pass by you, you perceive offensive odor. Is the repetition of the dress. You know, when they wear the dress gets wet with the sweat. After the end of the day, some will just dump that cloth. 2-3 days later, they can still pick it, which is not proper.
After sweating.
After sweating. Even if the cloth will not be worn immediately, you can air it if you don't want to wash it.
Okay.
So that at least breeze will blow it, and but the best is wash as frequent as possible. There are other things that causes body odor. In fact, with improper hygiene, some girls are avoided because of body odor. I heard of a girl that maybe lost the fiancé because they visited the family and someone said, why is she smelling like he goat? And they discourage him because they are ignorant of what is happening. It is just the normal changes at that age. But because of ignorance and lack of proper hygiene, the smell became something else. And almost all the holes in the body smells. So proper hygiene is very, very important. After one has applied proper hygiene on the body, on the clothing, and the odor is still there, it is always better to seek medical advice to rule out any underlying diseases, either from ENT, oral cavity, and things like that.
Okay. So how many times should the young girl bath in a day?
Minimum of twice.
After the whole day running up and then you just jump on your bed and change into another bed.
It is being done, but especially if the lady is menstruating, I think minimum of twice.
Yeah.
And after the day work in the night before sleeping, she should be able to bathe and wash all the undies and change.
So is it necessary to focus on all the areas? You know, some people, when they scrub their armpits, it's like they want to peel the skin on that. But before you open answer the question, we'll go on a break. When we come back, then we'll start dealing with the issue of when you see people scrubbing. We'll be right back, viewers.
In terms of true worship, we must seek the Lord. We will not be able to come with all our perfections.
We will recognize as superseding every other gift. So love, in essence, is very important. Our position is who we are. Our disposition is the way we relate to who we are. So it's not about your position, it's also about your disposition.
People of God, I want to tell you that no matter who you are, no matter your position, your status,
you have encountered that superior power, the efficacious power of the blessing.
It says this God hears prayers, and then he expands the limits of whose prayer is heard.
Welcome back, viewers. Before we went on the break, we were discussing teenage sexual and reproductive health. And my guest is still Mrs. Eunice Babatunde. She was a retired, or she is a retired chief matron from the Asokoro General Hospital here in Abuja, and she specialized in pediatric nurse. Thank you so much, ma. This is like staying in a lecture room and learning about health for teenagers, and I'm so happy about that.
It is important.
So before we went on the break, we were talking about, having shower, bathing, and some people, when they want to bath, they scrub the underarms, scrub the private area. Does that mean, is that the best way to ensure that you are clean there, or, and if somebody rubs it gently, does it make any difference?
Bathing is bathing with sponge and soap with water. One doesn't need to look for hard sponge as long as the person takes the bath regularly on daily basis. So I don't think there should be extraordinary pressure on the armpits or on the vulva area. Just the gentle and normal bathing and rinse well. By the time you bathe normally, regularly, dirt will not be able to accumulate under the armpits for someone to start scrubbing with all her strength.
Okay, and then the other thing is I want to talk about is washing the vulva area for normal girls. Even we're talking about teenagers, but there are some adults that don't really know. People use a lot of soap. They even use this thing you insert. You want to clean. I think it's like a pump, douche or so they call it. And then, to wipe and clean the vagina. There's a lot of story about cleaning the vagina. What's the best way to clean the vulva area?
I earlier explained that it's in folds. When the individual is bathing, after using your soap and sponge, you pour water and then concentrate on that area. Open the laps. The douching you are talking, you don't need any instrument to push into the vagina. Just open the lap and pour water, maybe 2 or 3 times. Some people have argued so much, use soap, don't use soap. Just use the mild soap you are using for your body.
Okay.
And by the time you concentrate on the folds, including the anus, the skin on the anus is also in folds. So there is need for one to clean very well. Because if you just wash the outside, you have not done much. So at least little of the inside, and not really going inside.
Yes.
You don't really need to go inside. And for those who have vaginal discharge, there are normal discharges for females.
I was going to even talk about that.
Okay.
There's normal discharge. So how does the discharge work? Because I know it varies at the different times of the month. Sometimes, but when it's really awful, I know there's problem. But the normal discharge that women are pulling out everything from you today.
It's necessary. You see, when we are talking of discharges in females, I will start from neonate. That's newborn baby. There are some newborn babies that are discharges.
Oh, really?
So that mothers outside there will not get worried when they see something like that. It is whitish. It is normal. It is part of the hormone that we drew into their body during pregnancy. Within few days, it will dry up. So mothers should not try using any drug or running up and down. Just give the baby normal bath. It will stop. But for teens and adolescents, there is what we call it occurs before menses.
Okay.
That one is normal.
Okay.
It is whitish, just like the white egg.
Okay.
That part that is white on egg, uncooked, well cooked. Exactly, just like that one is normal. It doesn't smell.
Okay.
In fact, it's beautiful. There is another discharge during ovulation.
Okay.
It's in between 2 menstrual periods.
Okay.
That period, there is possibility that egg has been discharged and a woman can be pregnant. That is just showing that this woman is ovulating. It's very clear and draws,
Okay.
just like catarrh.
Okay.
No offensive smell, nothing. It is normal.
So when you notice that, it is okay.
It is okay. There is no problem. You don't need drug. You don't need to panic. It is normal. When you think of abnormal discharge, it may be brownish in color. As long as it is not immediately after menses, because a day or 2 days after menstrual flow, there could be stains on the pant, or that one is also a bit brownish. If it is not associated to menstruation, and there is discharges that is brownish, greenish, dark in color, or things like that, it is abnormal. If it smells, it is abnormal. If that discharge is accompanied with vulvar itching, it is abnormal. You see, some women will be having itching. If it comes with painful micturition, that's passing urine. Maybe before passing urine, the girl feels some pains, or in between, it's as if she's having burning sensation and she has to stop before continuing. It is abnormal. If after passing urine, she experiences sharp pains or burning sensation, all discharges that period is abnormal. She should not be ashamed. She should not keep it to herself. The best is to seek medical advice. But before seeking medical advice at home, she should increase her water intake. If she takes water frequently, let's say 2-3 bottles, depending on the weather, you know, during rainy season. So if she takes enough water, she will pass urine more, and the burning sensation with urination will reduce. But for that discharge, she should seek medical advice to prevent complication.
Okay. Now there's a question I'll ask, because I want us to talk about the mouth odor thing, but there's a question I'll ask. And I remember I didn't know this for a long time, how to calculate your number of days of menstruation. In fact, I used to see my menses at odd times. I felt it was, every particular day, I must see my menses on that day. Unfortunately, so I remember I was now confusing it, and I had to go and meet the nurse. It was even the nurse in my secondary school then who taught me how to calculate it. So now, I wish I had a calendar here, but let's try to do it. How to calculate your number of days, you know, of menstruation. Where do you start counting from?
You know, I mentioned it briefly earlier. It's at the middle of your menses. Let's say you start menstruation today. Either I stop day 3, 4, or 5. You start counting. When you get to day 12, medically, some school of thought say it is just 1 day. But experience shows that to some individuals, it is more than 1 day. It could be up to 2 days. So when you count and you get to day 14 of your menses, there is, let's say you see menstruation on 1st of May. It may flow till day 4, day 5. It stops. Your counting is not starting from day 6. It starts from day 1.
Okay, the first day you see
the first day you see your period. And then when you count to 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. Between that period, the woman is most likely to ovulate. Another sign for ovulation is sharp pain on either lower abdomen. If it is the ovary at the right hand, you are likely to feel sharp pain. If it is the left one, you may feel it. It's not something that is very painful, but somebody who is conscious of her body may feel it. At times, some people feel maybe drowsy or tired. It depends on individual. Some don't even feel anything. It's just the counting that may help them.
Okay.
So if menses is 30 days cycle, the ovulation may get to day 15,
Okay.
still depending on individuals. So if it is 28 days, you watch for day 14.
Okay, so it's between the first day of the first period and the first day of the next
period.
We tell you the number of days you are
Days,
having
yes.
your menstrual.
Yes, if you have the calendar, you can be marking it.
Okay.
Because some are regular, some are not regular. So it depends on individual cycle. So it is always better to mark it on the calendar.
Okay, so sometimes I think it works as in a range, just as you were saying about ovulation. Some people say it's 1 day, but experience has shown it could be within a period of time. So you can see for 3-4 days, it could be your ovulation time. But from day 1, so if you want to know your cycle, is the first day to the last day. I think it's normally an average. Some people are 28, 27 in between.
28, 30.
Yeah.
Like that.
Between that. But it shouldn't be longer than that. The space shouldn't be longer than that. Or?
Well, even if it is longer, gynecologists may declare that as long as it is regular. Some is 31.
Okay.
So if it is regular, there is no problem.
So if you're starting for the first time, just be monitoring yourself to have an idea.
Yes.
Give you the first 3 months or so to have an idea of number of days.
It will give you guideline.
Okay.
The first 3 to 6 months will give you a guideline of what your cycle is.
Okay. So if somebody is watching and you're just starting your period, give it some time. Just note the first day you see the period, ever in your life, mark it somewhere. Abby, then you now wait for the next time you see the period, mark it somewhere, then keep following up like that. This is for a teenager, but if it's an older woman.
And it is also important to know that when a girl first sees menstruation, the following month it may not happen.
That's what I was about to ask, because I know it happened to me. The following month I didn't really say, okay, thank God I'm free.
So it may take some period before it will come again. So there is no cause for alarm. The girl should not worry. It's just the body changes. After some time it will regularize itself.
Okay. Now, the other thing I want to ask now would be maybe the older you get, but the thing is that these changes come with a lot of emotional. I want to talk a little bit about the emotional part, because that's where ladies fall victim of. Then you start feeling, oh, I'm now a woman, I'm now grown, I can make my decision, I can, I know when I was younger, my mom would beat. So that's what I'm trying to ask. So how do you handle the emotional part of this season of a woman's life, a young girl's life? Because it can be very confusing.
Thank you for this question. You see, pre-counseling is very important. That's why I commended you on this program. I believe people that are hearing it will know that it shouldn't be something that will come to meet one unaware. Mothers should prepare their children, their girl children. Let them know that when you are getting to this age, in between, you are likely to feel that you are becoming a grown-up girl. Your breast will increase, you will start seeing messes, and that is the period of being, you just get proud because you feel you have arrived. You see other adult females doing certain things, they walk, their breast is there, your own is there, so what is the big deal? But that is the time the mother should counsel the daughter. You are just starting. You are still far from there. This is just a change in life. And especially when it comes to sex, mothers should not be ashamed to mention sex and to lecture their daughters. Yes, boys need it, but more of girls. They should let them know that God hates sex outside marriage. 1 Corinthians 6 from verse 18 instructs us to flee every sexual immorality. And if you read down, it says our bodies is the temple of God. So if a mother knows that, she should inculcate it into the daughter and say, keep yourself pure. Your body is the temple of God. Yes, you can sit with a boy, you can chat, but don't remove your pants for any boy, depending on the age. There is an age when you talk of sex, they may not really understand, especially between age 6 to 10. But when you say, don't allow any boy to touch your breast is your own. Your private part is your own. Nobody. If anybody gives you anything, I say, don't tell mommy, don't tell daddy. It is danger light. Mention it when you get home. This teacher, this uncle gave me this. He said I should not tell you. Or somebody call you into a corner, touch your body, and if you tell anybody, you will die. Let her know that it is a lie. So that when it happens, she will remember that, oh, mommy told me that this thing is a lie. I will tell mommy that this son could touch me. Because it is when they don't talk, they will die.
Yes.
When they talk, they will live. So mothers have a lot of work to do in preparing their daughters for all these changes and facing sex.
Yes, yeah.
There's so much to teach girl children about sex.
That's what I want to even put over, because at that stage, your body will respond to physical. Maybe a guy comes, you're physically attracted. Your body, because this is the thing that most young girls will not talk about. When you see the opposite sex, you feel your body moving. You feel
especially when they say you are beautiful.
You're beautiful. Then your whole body
and they touch.
They touch, and then your body starts responding, and driving. If I'm mommy, some ladies, some people's breasts come in different sizes. So some ladies, theirs grow faster and becomes bigger. And then you hear even men telling them, let me massage it for you so that it will be normal. And of course, when you start touching a lady's breast, you don't know where her sensitive spot is. And then next thing she's feeling and she's okay. So, oh, are you feeling like this? Let me go ahead. So for those young girls, what should they do? How would they respond to this? Is it for them to say, no, don't touch me in this area, or be firm about it? And I like the fact you're bringing from a Christian point.
Yes. By the time you prepare a growing girl, that there are parts of her body that is no-go area for any other person. A girl that has grown, bathing herself, not even the mother will come and touch the breast or any part of the body, not even the father. So nobody, it's no-go area. So let her know that one before going out. So if any boy now say, your breast, your bum, just play, no. They should avoid environments that will expose them to such touch and danger. Parents should learn to tell their children, especially girl children, I love you, you are beautiful. When they hear it from home, and they get outside there, and a man or a boy is now saying, oh, I love you, you are looking beautiful, touching, they say, mommy and daddy has been telling me they love me.
So
none of them has. So they will now notice that this love with this type of touch is not normal. They will be able to be conscious of themselves and avoid such area. If they find themselves in a corner with a man alone, and the man is trying to touch, molest, or abuse, they should not keep quiet. They should raise their voice. It is better to bear the shame of shouting before it happened than to shout when it has happened.
Yes.
And devil is afraid too. The man will not be confident to be there when the girl is shouting. He will find his way and run away. But when they keep quiet, they touch head, they touch breast, leave me now. The man will say, this one is enjoying it. I learned of a biology teacher who taught the reproductive system in the class. And after the closing, he called one of the girls. I said, that thing I taught you in the class, the reproductive system. It's good for you to know the practical aspect of it, so that you will take the first, the first position when the exam comes out. Thank God for the head teacher that didn't close on time. He was trying to touch and say, this is one of the reproductive system when you do this. So things are happening. Things are happening, even in the house. Some of the aunties and uncles that we live with, we have to open our eye as parents to know if they are actually good relations or they are abusing our children.
So the knowledge of the lady, knowing that
it's very
my
important.
Body is my body.
Yes.
I own my body.
Yes.
I don't have, nobody should touch my body. And nobody should have access to my body. My body is my body. Very important.
Very important.
So the sensitive areas should not be a no-go area.
No-go area.
No-go area.
And when you feel sensitive, don't even let it bother you. Let go.
Yes.
Wipe it off your memory. Okay. It is when you continue to nurse it, you continue to imagine, if I do this, how will it be? If I turn like this, it is then
so
there will be problem.
They don't need to press themselves with hot water. They don't need to drink anything to come. Because
Nothing.
This is
And for those who experience painful menstruation, they are always told when you meet a man, it will not stop. It will stop. It's a lie.
Yes.
It is a lie from the devil, because when they have that sex, the complication is more. Sexually transmitted diseases is there. They can even be pregnant.
Yes.
Funny enough, people ovulate during menstruation. It's just that it is not common, but it happens. So they should not say, you are menstruating now, you cannot be pregnant. It's not true. If she's not pregnant, she can be infected.
Yeah.
And that infection can go as long as possible. If they are pregnant, they will now be telling them how to abort and things like that. The boy is free. Let me use that word.
Yeah.
Even if she said, this is the boy, it's not written on the boy. The boy can say, me? Where did you see me? I don't know you. Some will say, I'm not the only one. You could imagine that type of embarrassment. So it is the girl child that is most victim. So they should avoid it as much as possible.
So even when you notice these changes in your body, this maturity, this desire, the dangers of trying to play a little here and there is more than the discipline.
Just see any sign of maturity as God's gift.
Okay.
And manage it well.
Okay.
Nobody from outside should come and manage it. Nobody. It is you, your body. If there is confusion at any point in time, because that age is full of confusion. They should speak out, either to the mother or Sunday school teacher or any mature mother in the church. Let them feel free. They should speak out to the right direction. Yes, not an enemy that will teach them the wrong thing.
So sometimes it's advisable to go to someone older, like a mommy, a female coordinator in church. You can run up to them and speak to them, about
it's better.
Some of these things.
Because if she speaks to her mate, how is she sure that her mate is doing it right?
Oh yes, because I spoke to my mate about my period, and they said, you should use tissue. But she doesn't know any better. Yes. Okay. So just finally, so that we'll talk about this, our mouths, odor cleaning. For especially from birth, because some people say when they don't clean well. How do you even clean a baby's, a young girl's, for young male and female? Let me pull that one off you before I call you back again to talk on taking care of children.
That's oral hygiene. When you are bathing baby, as you bathe the baby, usually I just use my finger, clean the mouth, and by the time the child is bringing out teeth, 1, 2, you can use cotton wool.
Okay.
Just put it inside warm water, clean it.
Okay.
Then cotton bud, you can clean the tongue, because at times it gets whitish.
Yes, of course, it's very white.
Just clean it in out, 1 or twice.
Because
don't need
sometimes
to
if
go.
you give them toothbrush, they lick
Ah,
they lick.
Before you use toothbrush, maybe about the age of 4, 5, 6,
Oh, wow.
where you can say, don't swallow.
And they
Open
will
your
know not
mouth.
to swallow.
They will. At times they will do as if they are spitting out, but
everything has
nothing.
gone- it's
But
already sweet.
you are not putting too much
Yes,
paste.
yes,
So
pieces. Thank you so much.
oral hygiene is very important, even for adults.
Oh, that one is
So
like a
that's-
whole topic on adult on oral hygiene. All right, thank you so much, ma, for coming
Thank
on
you,
the program.
thank you.
It's so good to have you. I'm so happy. But Mom, you're coming back to talk on babies, how to take care of children. I'm bringing you back.
God will help us.
Yes, thank you. Mommy has given me a word.
It's a privilege. Thank you very
ma.
much.
Thank you so much for coming. Thank you. We learned so much today.
Thank
and
you.
viewers, thank you so much for staying with us. For the past couple of minutes, we've been discussing teenage sexual and reproductive health. And my guest has been Mrs. Eunice Babatunde. I call her Mommy. And she's retired chief matron at the Asokoro General Hospital here in Abuja, and she specialized in pediatric nurse. Thank you so much for joining us, and I believe you have learned so much today. And if you have any question, remember you can send it to the information on the screen right now, and then we'll be able to get back to you with an answer. If you want to speak to Mommy, Mommy's available to speak to. I hope Mommy will speak to us when we call in.
By
Thank
God's
you
grace.
Yes, thank you. Thank you so much, and I'll see you next time. My name is Angela Emeka Ebibo. Goodbye.
Thank you.